The measurement of blood pressure is one of the foundations of prenatal care. Taken at virtually every prenatal visit, it is the clinical tool which is used to predict and detect hypertensive disorders of pregnancy. Preeclampsia, which is one of the more severe forms of hypertensive disorders, has significant implications for both pregnant individuals and babies, with more severe cases leading to worse outcomes. So you must be wondering, why do we need a standardized screen for preeclampsia? Because studies have shown that low-dose aspirin, when given in the right dose at the right time to pregnant individuals at risk of preeclampsia, reduces the likelihood of getting it by up to 60%. Recent literature has endorsed a validated multiple marker screening method for preeclampsia, which incorporates background historical factors with current pregnancy factors, and this algorithm improves their ability to identify high-risk individuals who will benefit from timely introduction of aspirin as compared to those who require standard care. So what is this multiple marker screen for preeclampsia? It includes a standardized history, which is composed of items we normally identify in the prenatal record, like the pregnancy type, the pregnancy dating, personal characteristics, past medical history, and past obstetric history. It also includes an ultrasound marker and some blood markers, which are drawn at the 11 to 14 weeks prenatal visit. A very important component of this multiple marker screening method is a standardized blood pressure measurement, which is different from that what we routinely do during the rest of the pregnancy. Most of the healthcare providers, while measuring blood pressure for their pregnant patients during prenatal visits, take 1 to 2 measurements with often no established protocol while using a manual instrument. The standardized method of blood pressure measurement, which is accepted worldwide, has some components. First and foremost, make sure that the pregnant individual is well rested for at least 5 minutes before measuring blood pressure. It is important to have an appropriate cuff size, with the bladder length covering 80% of the arm circumference and bladder width covering 40% of the arm circumference of the pregnant individual. Automated method of blood pressure measurement is recommended. While measuring blood pressure of pregnant individual, make sure their back is well supported, their legs are uncrossed with both the feet touching the ground, both the arms are well supported and not hanging freely in air, and the blood pressure cuff is at the level of the heart. It is recommended to take 2 measurements in each arm simultaneously. By measuring blood pressure by the standard method, it is then entered in the screening algorithm and preeclampsia risk is generated. For those pregnant individuals at risk more than 1 in 100 are then classified as high risk and will benefit from offering low dose aspirin. If we have viewed this video, we would request you to move ahead with the post video survey.